Dr. Carr, our clinic is so well known for our focus on bioidentical hormones, and yet there are many physicians, including physicians in the space of longevity, that poo-poo bioidentical hormones because they come from a compounding pharmacy. Now, we've already clarified what is a bioidentical hormone, but
So
I'd like you to
Natasha,
just share.
I'm going to just reiterate that again because some people may be watching just this bit of the video. So number one, what is a bioidentical hormone? So bioidentical means it is biologically the same chemical structure as our bodies make. So for example, in women's hormone therapy, we talk about estrogen. So E2, there are many different types of estrogen.
Estradiol.
Estradiol. E2 is the most potent estrogen, and that is 17 beta estradiol is the chemical name for it. So that is exactly the chemical structure that our body's estrogen is. So when Natasha, you write a prescription for SE2, that is the 17 beta estradiol. So number one is bioidentical, means chemical structure of those hormones are exactly as what the body produces. The next question, Natasha, that we often face is the safety of compounded bioidentical, because bioidentical hormones are available as prescription products. So maybe you could talk a little bit about that, and then what is the challenge with compounding and why you've been using compounded bioidentical since, like, I don't know, 18 years.
But you and I have both been on them for
Oh yeah.
many, many years,
Yeah.
and we have no issues with either safety or efficacy. So, pharmaceutical medications are made by drug companies. They can be synthetic or bioidentical. The problem with pharmaceutical bioidenticals is they're fixed dose.
Hmm.
So, you can only give that dose that exists and in increments of that dose that exists.
Yeah.
Whereas with bioidentical hormones that are compounded, we can precisely customize the dose for you. So, Dr. Carr, you and I are both menopausal. You take a completely different dose of estrogen from me. Also, even if we both were given the same dose and it worked for us, our amounts of progesterone and testosterone and whatever other hormones we're on would be different.
Yeah.
Right? And so that whole combination is not the same one size fits all. It's very, very particular to that particular patient's circumstances and other hormone levels and balance. So you can't achieve that with pharmaceutical medication. You can only achieve precision and customized dosing through compounding. Why people have issues or the perception that compounding is bad is because not everyone is good at it. Not every pharmacy does it all day long. The pharmacy that we recommend, I have no shares in it. I get nothing from them, but I stick to this pharmacy. One, they get third-party testing. They have quality assurance. At any point, randomly throughout the year, they have their potency checked so that they know if we say it's 1.5 milligrams in here, then next time I make it, it's still going to have 1.5 milligrams. And so that's how I know. And because they have the right facility, there's no contamination. You're not going to have any issues with um, bacteria and other things growing in it because it was made. It's not made in someone's kitchen. It's made in a
No.
proper lab facility. But I will tell you this, and this is a quick story. Years ago, I had a patient from Lethbridge, and there's a compounding pharmacy in her city. And so she insisted on supporting local, and I said, fine. And Shabnam, I'm not kidding you. Every single time we checked her thyroid levels, it was somewhere completely crazy. I had no idea what was happening with her. And I kept thinking, what on earth is getting in the way of this? Could it be this other hormone, this toxin, that, your gut, your micro? I was going crazy trying to figure this out. And then finally I said to her, I said, do you know what? You're doing everything right and I can't figure this out. Can you just switch to a compounding pharmacy that I know and trust? And lo and behold, it was because the compounding pharmacy didn't compound enough, often enough at the time to be able to accurately, I don't know, calculate and compound properly so that each time she got a dose, which is exactly the same thing that happens in the natural health industry, right? Why supplement companies don't, we have so much criticism of them because batches can be different each time because they're not precision based, as opposed to a pharmaceutical grade nutraceutical that we use. So similar concept here. And so that's the thing about compounding. Compounding is beautiful. It allows us to customize, personalize the dose, and you have to use a pharmacy that is trusted with the right lab and the right safety protocols in place.
And another, something else that people talk about when they talk about compounding is, and you will never find Dr. Iyer and me ever saying that compounded hormones are safer than prescription pharmaceutical
Yes.
ones, because that is not true. And if anyone has told you that they're more natural, yes, they're made from soy and yam, but prescription medications are also made from natural things. So it's not that bioidenticals are safer. So it means that if you are on a bioidentical hormone, and usually if it's a woman, Dr. Iyer will give transdermal estrogens, and I'll just talk a little bit more about why bioidentical versus prescription. So it doesn't mean you just get your hormone prescription and you just keep slathering the estrogen on your skin and taking the oral micronized progesterone and you're good to go for the rest of your life. No, you need to be on a program to be monitored. The next thing is, Natasha, is E3 available as a prescription in Canada? And it's not, I know.
Estriol,
Yeah,
which is
estriol.
another type of estrogen.
E3 is a very, it has a low potency, which that is the reason we like it, because sometimes for things like vaginal dryness, it works very well. And
Leaky pee, incontinence.
when it's applied locally, and E3 is not available in Canada as a prescription product. So if you were to need that, where would you go? So that is where a compounding pharmacy would come. And the same thing goes for testosterone as well. So testosterone for women is a much lower dose. And I don't think there are any prescription testosterone products that are available.
You can use the nasal spray testosterone, which is available in Canada.
Okay.
It's a much lower dose, but it's not comfortable for people. They in the US, they're using it on demand for libido or sexual function. They're using it for women. Might be better tolerated by women because it's a low dose. Men don't do well with Natesto. They find that it burns and it's a 3 times a day dosing and they got to squirt it up their nose and it's not always amazing. Whereas, a compounded cream or and Androgel is your pharmaceutical prescription one. And I have yet to meet a man who loves putting so much gel all over their bodies. Whereas with compounded med, I can keep the amount of cream the same, and I can change the amount of hormone in that same amount of cream so that you're not using a whole jug full to get more. We can just change how much is in it for a small amount. So I think, yes, bioidentical hormones are my go-to. I've used them for so long that it's second nature to me. Do I ever prescribe pharmaceuticals? Absolutely. Some patients' insurance won't cover a compounded hormone. And so we have to try and make do. So there are 2 thyroid hormones that I will use that are pharmaceutical based and still bioidentical. Another thing about compounding, though, is like progesterone, for example. There's progestin, which is the synthetic, and you and I will never use it because the studies have proven that that was the reason we had that Women's Health Initiative study that said, oh, everybody shouldn't take hormones, they're going to kill you. But it was using a synthetic hormone in that study. But if we use prometrium, which is a bioidentical progesterone that's a pharmaceutical, we're limited to that dose only. It's 100 milligrams. Just yesterday, I gave someone 12.5 milligram capsules, and we're going to titrate and see because we always want to use the lowest effective dose. We never want to use more. You know, with high progesterone, you can gain weight, you can get insulin resistance worsening, you can gain belly fat, you can become diabetic over time. We don't do this to make you worse off than you were to begin with. We monitor all of these things, but we also always focus on lowest effective dose, and you cannot achieve that with pharmaceuticals. So
Yeah.
that's why we use bioidentical hormones. They're natural to your body, and why we use compounding pharmacies, because we can customize the dose for you.
Yeah, and so I'm concluding bioidentical, meaning it's exactly chemical structure is exactly what the body makes. Number two, compounded bioidenticals, the problem is always with quality control. So you have to be very sure of the compounding pharmacy has the right quality control in place. And Natasha, you have such a close relationship with the compounding pharmacy. You have actually called them and asked. I said, this is not happening. And they have said, okay, we'll get this tested by a third party to see if there's any problem
And
with
they
the.
can go back to the batch and have
Yeah,
a look. And so they've come back and said, nope, we tested that
yeah.
batch. We know that one's safe and that one's fine. So then I know to look at something
Then
different.
yeah, it
So thanks, Dr.
like
Kar.
the example you gave. And the third thing is compounded bioidenticals are not safer than the prescription the pharmaceutical bioidenticals. Any hormone therapy has to be supervised, and that
And
is very
monitored.
and monitored. So thank you very much. Thank you, Natasha. That was great.